ladies, so today we're talking about post-hysterectomy. I've given a couple update videos and I wanted to give another update because I've had a couple people ask me, so how are things going since my last video talking about that I had a little pain in my hip and buttocks area. So I just wanted to do an update on how that's going. So that's what we'll be talking about today. So let's go ahead and get into the video. Hey ladies, so welcome back to my channel. My name is Tejo. If you're new to the channel, welcome. Glad to see you here. So today we're talking about hysterectomy, post-hysterectomy. I had a lot of questions about, like an update. How are things going for me since I said I had some pain in my hip area, buttocks area, since having my surgery, but I thought it was an underlying issue. So we'll be discussing that today. And guess what? I was right. Please make sure you go check out my last video. I'll try to link it above. When I was talking about, hey, a life update, it's been 6 months since I had my hysterectomy. Everything was going great. Besides, I was having a small pain in my hip buttocks area. And I thought that it was possibly like an underlying issue that I had when I had my second child. And it looks like it was back. So I was going to physical therapy, and so it's been about a month now since going to physical therapy, and I'm so happy that I went and didn't keep prolonging because I did find out a couple things. So number one, I had a lot of scar tissue underneath. So scar tissue from my 2 C-sections and now a hysterectomy. So a lot of scar tissue in this area, in my abdomen area, which was causing issues to my buttocks because those muscles are attached together. So it was putting a strain because it couldn't elongate like it needed to. So it was becoming an issue. It was more so not even an issue with working out. It was just an issue all the time. It was so stiff. It hurt so bad. And it was because, your body adjusts to different things after surgery. And so it had gotten so tight. Right? It was so tight in the front from my scar tissue that it couldn't elongate like it needed to. It couldn't stretch. And so that was causing some of the issues. So number 2, find out that your girl had ab separation, right? Ab separation. Now, if you don't know, your girl used to have a 6-pack, okay? Boom, 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 boom. So, them abs was nice and tight after 2 kids, after 2 C-sections. I had a 6-pack, but my fibroids had gotten so big that it caused my uterus to obviously expand, and I'm tall. So I carried it a lot in my back, right? So you couldn't really tell that my stomach was poking out, but it was. So, the fibroids caused my stomach to expand, and it caused my abs to separate. Your girl didn't know that. The girl was like, the physical therapist was like, you have ab separation? No. She was like, yeah, you do. You need to work on your core to close that back up. And I was like, oh, okay. So, she was like, well, we'll work on it. We'll work on it. I was like, okay, awesome. Because of the issue with the scar tissue and the weak abs, the weak core from the ab separation, right? I didn't realize how weak my core had gotten. That causes me to have some issues with my hips. So my hip area, my glutes area was weak because my core was weak. It's so crazy how your body works together and it correlates, but because of all of that, it was causing a strain on my glutes area. When I first went, she did an assessment and she was so great. I'm still in therapy. This will more than likely be my last week. So it's been about a month actually. So, but my therapist was so awesome. She's very knowledgeable. I appreciate her so much. She did a full assessment on me. And then when I went to my next session, she did dry needling. So when she first asked me about dry needling, I was like, I never heard of it, but anything with a needle, I'm probably about to freak out. She was like, it's like acupuncture. Once again, I don't care. I'm about to freak out. So she showed me the needles, and they're really, really thin. They're long, but they're thin. And it's more so to help loosen up those muscles, deep down, those deep tissue muscles, so to help them relax a little bit. And so she ended up putting about 5 of those in me. I didn't feel them going in. You do feel them a little bit when it goes deep into your tissue, your muscles, but like it wasn't that bad. I think I kept him in for probably about 15-20 minutes. I don't really remember, but as soon as she took him out, she told me I would be sore, kind of like when you get a flu shot, for a couple days, to make sure I stretch. And I was sore, very sore, but afterwards it was like voila. And she said that she gets a lot of good results from it, and so I was like all about it. So she gave me plenty of exercises to do at home and while I was at physical therapy as well too, to help stretch it out. And like literally within weeks, I could see my range of motion changing, and I'm able to stretch out a little bit better, which was so exciting. She told me not to do any weights, pretty much don't work out on your lower body right now, while we were trying to rehabilitate my hip and core area. So I couldn't do any weights on my legs, so I've just been doing upper body. As far as working out, I couldn't run, couldn't jump rope, any of that, which was really hard for me. I'm like, so I did like bicycling or something like that, cycling, because I couldn't do any of the other stuff. And then last week, she started putting, maybe 2 weeks ago, she started putting a little weights. When I did squats, she was like, okay, I want to put 10 pounds on here. Tell me how you feel. And then, you know, it was fine. And then this past week, she asked me to go ahead and start my routine back with my legs, but do it very light. So like I did hip thrusts, and I didn't do over 100 pounds. It was very light. I did some squats, and I only did like 25 pounds with the squats, and that went okay. So this was different for me, because this is a girl who does like 300 pounds with hip thrusts, right, normally. But you know, I wanted to make sure I was doing things correctly so we could rehabilitate correctly. And I didn't have any pain. I didn't at all. Like, so it was a little soreness, of course, because I haven't worked on legs and glutes and like, you know, like with weights in a month. So, you know, that makes a difference. So, but as far as the hip, it's still a little soreness. Like, I mean, it's like on a scale from 1 to 10, I used to say it used to be a 9, because I couldn't even hardly get out the bed. It was so stiff. But now your girl is rolling over, you know, doing flips in the bed, and it's no problem. So I'm like, oh, okay, I'm so happy. So, I'm still making sure, you know, I'm doing my stretches, and I plan to continue to do that. So this week, she said, will probably be the last week for me, but to continue to do my stretches. So I make sure I stretch 1 or 2 times a day, and the stretches that she gave me for my hips and for my core. And so my core, I've already closed my core back up. I made sure, you know, obviously since I couldn't do legs, that I was really strictly working on upper body and core exercises, which really helped out tremendously. So if you're somebody who has ab separation, let me know if you want me to show you some videos that will help out with that. I definitely have some videos that I could show you, or I could show you some of the exercises that were really helpful, and close your girl right back on up. Once again, still have no regrets at all about surgery. I'm happy your girl is starting to see some core and abs coming back. I haven't really been trying that hard, but I just wanted to close up that core, the ab separation. I wanted to close that back up, and I'm so happy because your girl getting her waistline back. Giant. But I'm getting that waist back, you know, and it's just, you know, just confidence is like through the roof, as far as like, you know, not having to worry about looking like I'm pregnant, feeling bloated, in pain, planning trips with no worry about I'm going to flood on the plane or something. Those are just some of the things that used to worry me, and it's just like I feel so much freedom. Right? Not advertising for anybody to have this, but I'm just saying, like, you know, as somebody who has had it, you know, a lot of people, I was more concerned, like, oh my God, what's going to happen? But I mean, literally, guys, I have so much freedom right now. It's great. This minor issue that I'm having with the hips and glutes is nothing to me compared to what I was going through. And I'm almost done with that. You know, that was a quick fix. And like I said, it's an issue that pretty much I should have fixed a long time ago. I improved that you can get your body back. You can get a flat stomach after hysterectomy. It is very possible. You just have to do the work, okay? But I appreciate everybody checking in who has sent me messages like, you know, hey, how's physical therapy going? I appreciate it. So let me know, you know, if you've had a hysterectomy, what are some of the issues you had? Or if everything has been going great for you, let me know. You know, it's really good because I can tell just from comments from previous videos, these videos are very helpful for other people getting ready to go to surgery, because we all know it was very nerve-wracking. Small community, right? It's bigger than what it really is, but as far as people who are willing to share, it's very small. So make sure you are leaving comments about, you know, your journey, or if you're about to have a hysterectomy, what are some of your fears and concerns? If you haven't looked at any of my previous videos, or any of my videos haven't resonated with you, that's fine. You know, there's so many videos out there, but just make sure that before you go forward with the hysterectomy, you do your research. And you know, I just wish you the best if you are having one. But I appreciate you all watching the video, and I will see you all in the next video. Have a great week, all.